Well, if you have a persistent problem in your knee, you just might be eligible for a promising study that'll both treat and manage your case. Dr. Eloy Ochoa, Jr. is a board-certified orthopedic surgeon at the San Antonio Orthopedic Group, the only site for the NeoCart Clinical Trial here, all in Texas. Is that right, Doctor?
That's correct.
Yes.
We're very lucky, actually.
Yes, so this is exclusive. It's only here in San Antonio.
Only in San Antonio.
So tell us about the NeoCart clinical study.
Well, it's in its phase 3. Phase 2 looked pretty good. And it's basically a randomization between a tried and true method called microfracture and this new implant that is called NeoCart. We're
looking at some video right now. Describe this here.
Well, what we're looking at is the joint of a knee, and the white substance is the smooth hyaline substance that covers joints, and it actually creates a smooth gliding surface, and that's what can be injured. It can be injured with injuries that cause ligamentous injuries, or it can just be wear and tear, and these chondral defects are what we're targeting, and that's kind of what that little video is showing you.
Yeah, you want to make that jump shot, right?
Yeah, without any pain. Without any pain and swelling.
And also running. I mean, we talk about getting healthy and being active, and we want to make sure our joints are intact.
Absolutely.
Yes, and we also have a poster here to kind of show another illustration. Describe that to us.
Well, this is the patient that we're targeting. Essentially, they have what's called a chondral defect or a cartilage defect, and that's an isolated small area where the cartilage has been damaged, but the rest of the cartilage in the knee is relatively healthy. And that's the kind of patient that benefits from this type of implant.
Okay, so if you think you suffer from that type of pain, then that could be a signal for you that this clinical study could be for you.
That's right, and the pains, you know, it can be subtle sometimes. It can be just a simple pain, swelling of the knee after activities.
And
things of this nature.
So, Doctor, remind us now of some of the requirements, the criteria that we need to keep in mind.
Well, patients need to be between the ages of 18 and 55.
Okay.
And they can have treatments for these types of injuries in the past, so that kind of takes them out of the study. And we're looking for non-smokers. There's some leeway there, but essentially non-smokers.
Okay, and meet additional study criteria as well,
Sure.
Correct? You know, we wondered sometimes if we become a part of a clinical study, will this cost us anything?
Well, that's kind of the benefit. If you do make it into the study, the costs are covered.
The costs are covered.
Yeah.
If you have that kind of pain, you might want to consider NeoCart, right?
Maybe something that we can help you with.
Okay, well, thank you so much, Doctor. Once again, NeoCart study. For more information, you can call them at this number, 830-477-0607. Check out their website if you have some questions as well, neocartimplant.com. Thank you again, Doctor.
Thank you.
Thank you so much.